Hey everyone, welcome to What in the Sono World. I'm Carrie, your host, and today we're going to be talking about dun, 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 the adrenal glands. And I already know what you're thinking, Carrie, we don't even scan the adrenal glands. I know, that just makes it that much more important because we need to know what they are, where they are, how they function, and why in the world we might be scanning them. So let's get into it. What are the adrenal glands? They are a triangular shaped gland located in the perirenal space. They measure 4 to 6 centimeters long, 2 to 3 centimeters wide, and about 0.5 centimeters thick. They are located superior, anterior, and medial to the kidney. They are part of the endocrine system, and a fun fact, they're the smallest paired organs in the abdomen. They are responsible for maintaining homeostasis and regulating hormonal production and secretion within the body. Don't worry, we'll get to all this in a bit. It's important for us to understand the structure of the adrenal glands to help us understand the function. So starting off with the adrenal medulla. If we break this down from the beginning, the medulla originates from the neuroectodermal cells. The adrenal cortex will envelop these cells during the 7th week of gestation, making this the innermost portion of the adrenal gland. They differentiate into the chromaffin cells. These cells are responsible for the secretion and synthesis of epinephrine and norepinephrine. These are responsible for your fight or flight response. So thinking of the fight or flight response, you get stress activated, there's a bear in the woods, he's coming after you. So the stress hits your hypothalamus, that sends a nerve impulse down to your spinal cord, which sends an impulse down to your adrenal gland that releases the norepinephrine and the epinephrine into the blood vessels. This increases your heart rate, your liver converts glycogen into glucose, it decreases the digestive system, your blood pressure gets raised, and then your bronchioles are dilated. So then if you decide you want to run from the bear or fight the bear, you're able to. All right, moving outward to the adrenal cortex. The adrenal cortex is broken down into 3 zones that are all responsible for different functions. These originate from the mesenchymal cells between the 6th and 8th week of gestation. These are regulated by the anterior pituitary gland, specifically from the ACH that are released from the ACTH in response to the adrenal functions. All right, so starting from the outside, working our way in. The zona glomerulosa synthesizes aldosterone, a mineralocorticoid. Aldosterone regulates sodium and potassium levels. The middle layer, the zona fasciculata, produces glucocorticoids, primarily cortisol. Cortisol regulates glucose metabolism. In the innermost layer, the zona reticularis supplements sex hormones produced by the reproductive organs. Now, when I was doing my research, I came across the 3 S's: salt, sugar, and sex. This here is a great way to remember which zone is responsible for which one. All right, let's do name that zone. Starting with the blue layer, zona glomerulosa. The red circle, zona fasciculata. The yellow, zona reticularis. This is all part of the adrenal cortex. To round it out, the black inner circle, adrenal medulla, and the outside is the perirenal fascia. This image had the opportunity to show the different layers of the adrenal gland and the thickness of each one. I also liked it because it kind of leads me into my next point with how vascular the adrenal gland really is. Yes, the adrenal glands are extremely vascular. Part of the reason why is because the adrenal glands are receiving blood from 3 suprarenal arteries. These arteries are the superior, medial, and inferior. The superior artery is originating from the inferior phrenic artery, the medial is originating from the abdominal aorta, and the inferior is coming from the main renal artery. If you look at this image, it does a great job showing where the arteries are entering into the adrenals and then where the suprarenal veins are dumping back into. The right is emptying into the IVC and the left is emptying into the left renal. So now let's get to that question, why? Why are we talking about the adrenals when they are so hard to visualize via ultrasound? Well, we need to know what they look like normally so then we can notice when there's an abnormality. And it's important to keep in mind that the adrenals are definitely easier to see in young children as opposed to adults. Part of that reason is that adrenals are 1/3 of the size of the kidney versus in an adult where it's 1/13 the size of the kidney. So it's going to look like an inverted V or a Y shape. The medulla is going to be the most prominent, and overall, it's more echogenic relative to the background retroperitoneal fat. Don't mistake it for a lymph node, a small bowel loop, or a lesion coming from the liver and the kidneys and the pancreas are a lot of times mistaken for a mass. These images represent what you would see sonographically if you come across an adrenal gland. These ones here are both normal. If you notice in the neonate, it's easier to see due to the hypoechoic cortex and the hyperechoic medulla. So let's talk about some abnormalities. Denise, I'm sure we'll get into these. Everybody turn around and say, hey, Denise. I just want to touch base on a few. The adrenal adenomas represent 60 to 80% of all adrenal masses. They're generally benign. They come in functioning and non-functioning. Some of the examples are Cushing syndrome and Conn syndrome. We also have adrenal cysts, which are uncommon. Adrenal hemorrhage associated with anticoagulant use, trauma, surgery, sepsis. TB is one of the most common causes of adrenal insufficiencies worldwide. Adrenal cortical carcinoma, it's rare and malignant. And METS is the most common malignant lesion of the adrenal gland, 35% coming from the lungs. Here are a few images of adrenal adenomas. They are generally less than 3 centimeters in size. Sonographically, they appear as small, homogeneous, hypoechoic masses with well-defined borders and have no substantial vascularity. Here we have an image of an adrenal hemorrhage. Depending on what stage the hemorrhage you see it is in, it's going to look different. Early on, they can appear solid. As it progresses, it gets more heterogeneous with the echogenicity, and then eventually it can even look cystic. This here is an adrenal. Here's just a few diseases that I came across when I was researching. Addison's disease is an undersecretion of the hormones by the adrenal cortex. It's rare, it's more common in females, 2 to 1. Cushing's is an overproduction of aldosterone, mainly because of benign pituitary tumor or an adrenal tumor. Conn syndrome was a benign tumor in the adrenal cortex, which is also very rare. The last abnormality I want to share with you guys today is a fatal congenital disorder known as Potter syndrome, where it's complete renal agenesis. And the fetus's adrenal glands assume a discoid shape and occupy the renal beds, mimicking the absent kidney. And it's important that we're able to distinguish between the adrenal gland and the absent kidney in order to help out the doctor so they can take the next steps needed. Ladies, these are my life-size pair of adrenal glands. I will bring them to class so you can actually get to hang on to them. Hey class, hopefully that wasn't too painful for you guys. I'm definitely glad it's over, but I feel like I learned as much as I could learn about the adrenal glands. I started the project way before Denise's PowerPoints came out, so I kind of had to hit the books and learn it on the go. But I feel like it added to my learning experience because when I was doing some research, there's a pyramid, and 90% of what you can teach in a project you do is something that you actually learned and that you kind of put into your bank. So, ta-da, here I am. So not only did I learn everything that I put in the presentation here, I also learned how to make a video and kind of put it all together. Luckily, I have a pretty savvy 12-year-old that kind of helped me along the way. I put major effort into this. Between the research and figuring out how to make the movie and getting everything done, it's probably about 15 hours or so that I stuck together. So, anyways, glad it's over. Have a awesome rest of your day. Bye.